on research publications with Pakistan Journal of Ophthalmology. Pakistan Journal of Ophthalmology is an open access peer reviewed journal that is recognized by Scopus, Index, Copernicus, and also by the Higher Education Commission. I would like to invite Professor Taiba Gul Malik for her talk on the peer review models.
Assalamu alaikum and good afternoon. I was supposed to present my talk in second number, but Professor Moin was supposed to talk on what is peer review and why is peer review important. Anyways, starting with the peer review models. ये काम नहीं कर रहा? Not very long ago, just a few months back, when I was searching for peer reviewers for Pakistan Journal of Ophthalmology, somebody asked me, what has peer got to do with research journal and research articles? And I told him that it was not that peer, it was this peer. Then the next question was, what has this peer or this peer got to do with scientific journal? Then I decided it is very important that we should conduct an instructional course or training for peer reviewers. This is a short questionnaire. Just open your cameras. You can answer there are just two questions. Done? Okay. In the next few minutes, I'm going to talk about these different types of peer reviews. Coming to the first type, that is single blind peer review. As the name indicates, in this case, the author is blinded and the reviewer knows the name of the author. And the advantages are, as the reviewer knows the name of the author and author does not know the name of the reviewer can give a real, honest review. But there are certain disadvantages. Number one, the reviews might be rude, as the reviewer knows that nobody knows his name. He can be rude. Or there is risk of bias from the reviewer for someone they consider to be a rival, as they know the name of the author. And sometimes the reviewer may be more focused on author than the real work. Second type of peer review is the double-blind peer review. And this is the type of peer review which is commonly followed. And in Pakistan Journal of Ophthalmology, we are following this double-blind peer review. What happens? The author does not know the name of the reviewer, and the reviewer also does not know what is the name of the author. Their advantages are, there is less risk of bias because both are blinded, and the reviewers, they feel more protected as their name is not going to be disclosed. So the advantages are, the reviews are more constructive and polite. Just a minute, it's not that. So as the author as well as the reviewer, both are blinded, there is less risk of bias and reviewers, they feel more protected. The disadvantages, as the reviewer's name is not disclosed, he can be rude. And sometimes, in cases where the research is very specific type of research, it is not always possible to hide the identity of the author. Open peer review is the type of peer review which is now being commonly adopted by very high impact journals. And one of the Pakistani journal which is following this model is the PJMS, Pakistan Journal of Medical Sciences. They are following open peer review. There are about 122 different definitions of this type of peer review, where the author knows the name of the reviewer and reviewer also knows the name of the author. And one of the sub-model of this type of open peer review is that names of the reviewers are published along with the manuscript. And there are some journals which also publish the earlier basic version of the manuscript. Advantages are the reviews are more constructive and more polite, as the reviewer knows his name is going to be published, and the details of the review process, they increase the trust of the journal. Disadvantages: sometimes as the name of the reviewer is going to be disclosed, there are reviewers who say no to review the article. Triple blind peer review, not commonly followed, difficult to follow, in which the author, the reviewer, and the editor, they are all blinded. Another type of peer review is the post-publication peer review, and it is also now being commonly adopted. In this case, as the name indicates, the article is published and the reviews, they are taken after that, and these are the open reviews. Advantages are there is an opportunity to gather a wide range of perspectives, as there are wider number of readers who can comment and give their reviews, and the new data is continuously added into the reviews. Another advantage is that the articles can be published very quickly. Disadvantages: there is risk in those cases in which some medicine is involved. For example, an article is published which shows some advantages of any new drug, and that is not peer reviewed, and later on it comes out to be a harmful drug, then again you can see there is risk of harm to the patient. Second disadvantage is that in case of controversial topics, there are a large number of reviews which cannot be moderated. And sometimes, again, some papers, they do not get even a single review. Another type, that is the collaborative peer review. In this type, an editor, he provides a platform for the reviewers and the authors and the co-authors. They discuss the points which are to be reviewed, and then the final consensus is made and the final article is published after the collaborative peer review. Third-party peer review is another type in which the authors, they get their articles reviewed by an independent third party, and they then submit their article along with the peer review that has been already done. Cascading peer review. In this, there are certain journals, they have collaborated among themselves. If an article is submitted in journal A and they find that it is not suitable for this journal, and they know another journal which is supposed to publish such type of articles, they can send their article with the reviews to the other article. So this is cascading peer review. Registered reports, very uncommon, very rare. In this case, the peer review takes place in two parts. In the first part, the data which is collected is sent to the journal and they give feedback. If it is accepted, the data is then sent back to the author. He analyzes the data and then the article is again submitted to the same journal for publication. The advantages are the negative results are also published. The journal cannot say no in this case as they have seen the data before the analysis. The disadvantage, ideally the first and the second review should be by the same reviewers, but sometimes it becomes very difficult that the same type of reviewers, they go through the same manuscript one after the other. Just to summarize, single blind peer review, the reviewer is unknown. Double blind peer review, author does not know the name of the reviewer does not know the name of the author. Open peer review, hi, I am your reviewer, and hi, I am your author. Both they know each other. Post-publication peer review, article is published and the reviews are there. Reviews come afterwards. Collaborative peer review, editor provides a platform, author and reviewer, they go through the article at the same time. Cascading peer review, two journals, one say no, but send the article with the reviews to the other journal, and then the article is submitted as published. Thank you so much.
Thank you, ma'am, for an elaborative discussion on the peer review models. I welcome Professor Mohammad Moin, who is Editor-in-Chief of Pakistan Journal of Ophthalmology. I invite you, sir, to deliver a talk on the importance of peer review.
Assalamu alaikum, and thank you very much, Shahir, for asking me. I think, I got late from the Central Council meeting. So Dr. Tayyiba has done most of my job, so it's easier for me. So I'll start off with a video of the peer review process.
If you've published research before, you're probably already familiar with the peer
how
review
the peer
process.
review starts.
But in case you haven't, or have never thought much about why the peer review process is set up the way it is, here's a refresher. Each journal does things a little differently, but when an author sends in a manuscript for a quick screening to make sure it's ready for review, then the editor-in-chief decides whether the paper is a good fit for the journal. Typically, the editor-in-chief is interested in whether the work fits the scope of the journal, will be interesting to the journal's target audience, and is generally performed at a high level. If it doesn't meet these criteria, the manuscript may be rejected. But if the manuscript seems promising, it's assigned to an editor with subject area expertise, usually an associate editor. This editor also critically evaluates the manuscript, considering the scope, whether the work moves the field forward, and if the results are of high quality. Only if the paper passes this test too does it formally enter peer review. At this point, the associate editor selects scientists with relevant expertise to review the manuscript. Some reviewers may decline the invitation, and it may take several weeks for the completed reviews to come in. Once the editor has enough high-quality reviews in hand, he or she then makes the decision to accept, reject, or request a revised manuscript that addresses the reviewer's concerns. This decision is based on a personal evaluation of the manuscript. Typically, the authors don't know who has reviewed their paper. This process is called single-blind review. Some journals may opt for a double-blind review in which both authors and reviewers are unknown to each other, or the review process can be completely open. Regardless of the type of review, peer reviewers are critical to evaluating the suitability of the manuscript for publication. Although at least 2 editors assess the manuscript even before it goes out for review, the most rigorous vetting falls to the peer reviewers, who are likely to be subject matter experts and therefore in a better position to offer valuable and specific commentary.
So thank you. Here, my presentation. So I think this is... So this summarizes what a peer review is and how it goes through. And anything's left, I'll just go through that. And what so we did this is his main job is to fulfill two main functions. Filter, guarantee the only high quality research is published and somebody has gone through that. So Dr. Taiba has already mentioned that you do not want to publish which might be although the articles goes through ethical reviews, but there are still some concern that this might not be ethically correct. That is one thing which is there. And then the quality of the paper, and obviously the finding of the paper which the reviewer might, because you select a person who is a subject specialist, so he knows what the other person is talking, and he probably knows mostly about the references which he has quoted, and he can sort of quickly inference the findings or the results that they match what is there as a face validity of that paper. So basically it's going to enhance the quality of accepted articles for publication. Peer reviewers advise writers on improving the quality of their papers and highlight any problems. So initially when we are working in PJO, the initial problem we used to have was the whenever we do a peer review from a person who's very high skilled, the main problem would be more rejections. So if you do it from a low quality reviewer, then you will have publications or acceptance which are sort of very lenient, and you would be publishing lower quality of papers. So over the years, initially we used to help as editorial board members to the authors, sort of to support them, sort of give them scaffolding to improve the papers so that it could be brought up to the level for PGO. But now we have more indexations. Now we are indexed with the HEC, with the College of Physicians and Surgeons. So slowly we are going to sort of increase the number of rejections, because the number of articles are flowing in much more than what they used to be. And with that, obviously, you have the ability to have better peer review, involve more people from international peer review. So that will give you the ability to improve your content, which is most essential to go higher, because our main aim is to get into PubMed, so that obviously the worth of the article becomes, or the journal becomes more. So this also motivates the writers to strive for high quality content. By helping them in peer review, I think with the authors, sometimes some of them, we have helped them grow over time, and those authors are now much more improved in writing their papers. The only problem is, if you are writing if you're in the editorial board, you cannot write papers for that journal. That is an issue with HEC, which we understand, which we know. Like, I am the editor-in-chief, I cannot publish in that. So people sometimes say, take me off the editorial board and I just want to send papers. So that is another thing which is important to know. The main purpose is to intend to examine the validity and quality, in some case the originality of work submitted for publication. So most of the publications, some of the journals like CPSP and the other journals, they'll ask for all your data. Now we have a dedicated statistician, who's sort of involved with us in initial triage of the manuscript, and then putting them in the right category and showing it to the editor, so that you get the first editorial decision that sort of goes on to the next associate editor, or it just goes on to the peer review, depend on what the workload is. Now we have, I think Shahir is working with Dr. Taiba as well, and we are so he's shadowing what she does, and then independently you're building on to the process that we can increase that. So Dr. Hargun has been here as a reviewer, so he knows as a peer review that the difficulties which we go through and all the editors go through. The author, so we've already shown that the initial is rejected or sent to the peer reviewer. The delivers, so is there any significant or minor fault, is it accepted with minor changes? But if there's a major review, then obviously is totally rejected for new submission. Initially, we used to say that you can submit a major review again, but now if there's a major review, we ask them to just resubmit, because if we ask them to sort of resubmit a major submission, sort of for reevaluation, then our processing times goes up. So if we keep sending for major reviews, so it goes up to 3, 6, 9 months. But according to the quality peer review, you have to keep it within 3 to 6 months. You have to give a decision to the person who's submitting it. So that is an issue why we ask somebody to just resubmit it so that it comes off from our system of OJS. The three most prevalent are single blind, double blind, and open peer review. I think Dr. Taiba even went further and she's told you the 7 type of peer reviews which are there. So then there are instruction for peer reviewers that they can go and check what are the peer review processes, and if somebody is new, how do you recruit peer reviewers? That is an issue which every journal faces. One is you have a link to the on your journal that if somebody wants to become a reviewer, he sends his consent and then you include them, or you can ask your good authors to become peer reviewers. So those are the things which you use. So the greatest thing that peer review can do is increase the quality of the published article, and it accomplished by encouraging authors to submit work at a higher level and then improving their the publication via the peer review process. Thank you very much. Time. So what do you understand by paper review? What is your understanding? What would be paper review? Oh, so you're saying the paper review. So the journal editor will see it, but he needs to get validation from two more people. That is the reason you send it for peer review. And the journal editor might not be a subject specialist for that topic. So if I am a retina specialist, the paper is from cornea, we need to send it to a peer reviewer that he has that interest and he's sort of accomplished to do that task. That is the reason for getting peer review. जिस तरह के दो गवाहियों वाला काम है, this is the same thing, that two people validate, see, and one person probably cannot pick up the mistakes that other person can. And then if you have a good quality peer reviewer, he can pick up more mistakes, because peer reviewing is an art as well. It takes time for you to pick up mistakes. आपको रेफरेंसेस देख के पता लग जाता है ये गलत है, फौरन स्कैन करके पता लग जाता है कि ये क्या चीज है. So the faster you become, the easier, and the more feedback you give, and the more mistakes you pick, the higher your journal goes up. So the peer reviewer is actually helping the editor do a lot. Thing is sorted out. लेकिन आप जो कह रहे हैं वो यही हो रहा था पहले, हम ज्यादा यही कर रहे थे कि एडिटर ही काम कर रहा है ज्यादा, लेकिन अब आहिस्ता आहिस्ता कोशिश करें कि एज इंटरनेशनली इट डज कि यू हैव मोर peer review and more robust peer review so that you get a better result. ठीक है. वो whenever a peer reviewer when you ask a peer reviewer to submit a review, once it's submitted, there's also an option that says, do you want to see that article again or not? So if he agrees to seeing it again, you send it to him. If not, then obviously it goes to another author. If he accepts it, it's better that he knows that this is what it is. Either then the editor can take up those things, or you can send it to another peer reviewer. But obviously, if it goes to another peer review, it sort of totally changes the. I think, Dr. Taiba, what do? You usually use the editor's discretion on that then? Yeah. Any more questions? Hargun?
Peer reviewer. So what happens sometimes they hide the name, but their institute name comes to us. I mean, for reviewer. So it again become biased. It's from this institute. So try to hide those as well.
Yeah, we're working on that. So even some higher, even CPSP sends them, we still find out unka bhi miss ho jata hai kai baar, because sometimes they mention it somewhere else. So that is a thing which is we try to overcome it, but sometimes wo aata jata hai. That you are absolutely correct. Any other question? Chale, thank you.
Thank you, Professor Moin, for your pearls of wisdom. Next, I will talk about writing the peer review report. whenever you get a request from the journal's office to review a paper, there are certain things that you should check before accepting the peer review. One of these is that Professor Moin has touched a bit. If you are familiar with that particular subspecialty or that area of interest of the researcher, then you should accept the review, otherwise decline it. You should not have any conflicts of interest. If you come to know that you know the authors or one of the authors or researchers, and you have any personal disagreement or personal affiliations with the researchers or the authors, then you should not accept it, and only accept it when you have enough time to follow the timeline of the journal. Once you have accepted the peer review, the first and foremost thing to do is visit the journal's website and check the journal's scope of publication and any instructions or guidelines for the reviewers and authors. Usually, almost all of the journals have peer review performers, and it is better to read those performers beforehand, before going through the manuscript, before reviewing it and sending your report. This might save you some inconvenience in the mid or at the end. And whenever you start the assessment of an article, always give at least 2 readings, and try to find some time for yourself to ponder upon that article in between those 2 readings. And in those 2 readings, you can assess the grammatical mistakes, errors, headings, references, any mistakes that you can find. And when you have gone through that research article, you should ask some key questions. Is the research novel? You should assess whether the research paper or the results or the conclusion is going to add something new to the already existing literature or not. Almost all of the times, authors provide a background of their research with references, but we have to assess that are these references adequately cited, or are they relevant to the study topic. Next is an important question. Research question is the objective or title of the study, and the conclusion or the results are the answers to that research question. You should assess whether the title or the objective of the study is being answered in the results or conclusion of the studies. Sometimes the conclusion of the study does not match the objective of the study. You should assess that. These 2 things should match with each other. The results should be provided in such a manner that they are comprehensible to the common reader. And anyone from outside of that subspecialty or specialty should be able to comprehend and understand those results. And other considerations, ethical or financial or any other considerations, should be properly disclosed. Once you have gone through the research article and you are ready to submit your report to the journal, the first thing to report is how do you summarize that article? What is your impression of that research article? And the thing to do and the thing to mention in that summary is start with the positive points, start with the good things in that article. Then you can switch out to any of the major issues that you have pointed in that article. What are the major issues? We all know that every research article have some key components: abstract, introduction, methodology, results, and discussion. There are key components and fundamental elements that need to be presented in those components. If any of them is missing or deficient, these are the major issues that needs to be pointed out after the summary. Minor issues are the grammatical mistakes, typing errors, or some errors in the referencing or citations. And in the end, the important thing is your recommendation, whether you would like to revise, you would like the authors to revise your manuscript or accept or reject it. This is an inverted pyramid of the points that I've talked about in the previous slide. When you have reviewed, when you have given your peer review report, you summarize your impression about the research article. What was good about it, start from it, and then go to the major and minor issues, followed by the recommendation. Whenever we do review the articles, we tend to write our comments whenever we feel there is some correction or deficiency is there. Here are some of the do's and don'ts of giving feedback on the research paper. Whenever you write a comment, whenever you point out something, always justify your recommendation with concrete evidence. You can also provide a reference in your comments to the authors. Always be to the point and specific to the authors so that they might know what they need to correct or what they need to incorporate new in their manuscript. Be thorough and constructive. Be professional and respectful. Do not be too critical of the writing or grammatical mistakes or the flow of the article. Do not be judgmental, and always remember to say what you liked about it, the article. Start from the positive things and then point out the deficiencies or the improvements that need to be taken into account. Do not ever recommend additional experiments or interventions within the research of the article. The idea is to preserve the essence of the research, preserve the essence of the authors, the way they have presented the research. The idea is to preserve that. As a reviewer, we do not need to be over judgmental and bossy and recommend additional experiments and interventions and very major changes to change the article completely. Sometimes this may lead to the article being going out of the scope of the journal. Do not tell exactly what to do. The authors just point out the mistakes and let the authors do their work. And do not use the review to promote your own research or hypothesis. When I was doing the certificate course in medical journalism, our facilitators used to tell some stories about an article was sent to a peer reviewer, and after the peer review it was sent back to the journal, and later on, before that particular article was published, another article with the same research topic and objective was published elsewhere. So we should not use these reviews to promote our own research and hypothesis. Do not focus too much on the typos and grammars or any other things. If there is too much, you think there's too many mistakes, then send back to the journal for corrections. Always give a read before you click that button, submit to the journal. Before you click that button, always proofread your comments and your recommendations. I will show you some examples of comments. The idea is not to be too critical or too judgmental. This is an example. And this is the way of saying by another manner. You should point out, but you should not be disrespectful or negative or too critical. This is another example. If there is something, you feel there is something wrong with the writing or anything else, you can advise or you can request the authors to improve it or to correct it. But this is not the way of giving feedback on a research article. This is the last one. It is obvious we should not be judgmental. We do not know what was going on in the mind of the basic research conceiver, the principal investigator. We're just here to review the article, the way it is presented. In the end, there are a few tips. Providing high quality review increases your likelihood to be asked to review again. And if you are interested, you can use this opportunity to build your rapport with the editorial office and the editor. And this will enhance your learning as well as the creditability of the journal. This is the summary of my talk. The peer review has to be constructive, organized, sportive, actionable, and thorough. Thank you. Organized, sportive, actionable, and thorough. Thank you. जी आई थिंक ऑथर्स को उसमें एड्रेस करना ज़रूरी नहीं होता, क्योंकि इवेंचुअली द आर्टिकल, if the article needs revision, it will end up with the authors eventually. So we just need to point out the mistakes or deficiencies that we feel there are, and just send it back to the journal, and they will forward it to the authors, and the authors will obviously read it and go through it and comply with the necessary incorporations that are required.
Right. Thank you so much.
Sir, you have mentioned that you did some course in medical journalism. Sir, वो कहाँ से किया और कैसे हो सकता है? पाकिस्तान में हो रहा
ये
है?
सर एक सर्टिफिकेट कोर्स है, यूनिवर्सिटी ऑफ हेल्थ साइंसेज करवाती है. प्रोफेसर मोइन साहब इज़ द एडिटर इन चीफ ऑफ PJO. प्रोफेसर तैयबा गुल मलिक इज़ द मैनेजिंग एडिटर. दे बोथ हैव डन दिस कोर्स. और उसके बाद जो नेक्स्ट बैच था उसमें मैंने किया था. यूनिवर्सिटी ऑफ हेल्थ साइंसेज 6 मंथ का सर्टिफिकेट कोर्स करवाती है, तो आप उनकी वेबसाइट विजिट करते रहें तो उस पर वो आपको इन्फॉर्मेशन उसकी मिल जाएगी.
Course, certificate course in medical editing and journalism.
यस.
CMEG.
Thank you. I now invite Professor Sanaullah Jan Saab to present his talk on ethical issues in peer review.
Thank you, Dr. Shahid. Peer review and ethics. I will be talking about the ethical issues when you are reviewing the articles. This is very usual for all of us, especially for the faculty members. They would receive an article request to be reviewed, and then they sometime because there is certain ethical issue. If you don't know about them, if you are not aware of them, then there is more chance that there will be some ethical violation during that review process. So I will be highlighting those issues. I don't have any conflict of interest regarding my today's presentation. So I will be going through short introduction to peer review ethics, then what are the actual objectives of the peer review, and then what are the ethical issues and how to avoid them. Let me start with the quote that ethic is the activity of man directed to secure the inner perfection of his own personality. So ethic is the story of what is wrong and what is right, why it is wrong and why it is right, and how should we do it, what should we do it and how we should do it. So if it comes to our medical practice, when we are dealing with our patient, it's called clinical ethics or medical ethics. And when it relates to our research studies, research trials, then it is labeled as research ethics. Publication ethics is the term which comes under the umbrella of research ethics, because publication is the ultimate outcome. If you want to share your evidence data, which you are the conclusion of your study with your fraternity. Peer review ethics is a part of publication ethics. So there are different bodies globally, like Committee of Publication Ethics, International Committee for Medical Journal Editors, and World Association of Medical Editors. And these bodies actually provide code of conduct and best practice guidelines that define publication ethics and advises editors on how to handle cases of research and publication misconducts and ethical violations. So ethical issues can occur at different stages of the research, like it may be there at the time when the study is being designed, when the data is, researchers are retrieving data, or when they are analyzing data, or when they are writing the medical manuscript, or when they are reviewing, or it's maybe related to the editors when they are editing, and then the publishing or publishers. I will be focusing on the ethical issues related to reviewers. So, because research and publication ultimately influences our clinical practice, the evidence and the data which we produce will be ultimately reflected in making strategies how to deal our patient, how to deal the pathology which we confront in our day-to-day life. So, ethical issue in publication will be directly affecting our patient care and our suffering humanity or community. So why will there will be issues? Because the actual objectives of medical research are usually not in focus. When we are doing research for the purpose of promotions. We are doing research just to increase our face value, and this is very usual. And many other, but the actual objectives are to produce dependable and accurate data and evidence, which then you can apply for the patient care and your clinical practice. But second point which is important with the research is that you have to keep the patient rights and safety intact during this research process. So when you are asked to review the article or manuscript, you are asked to set the standards which are expected in research and publications. And this you do it with collective and objective opinion of the experts. Scientific work, research study, or the final manuscript, medical writing, which comes to you for review, that is scrutinized by experts of that field, and they may get rejected, modified as per recommendation of the reviewers, and then get published. So reviewers are usually volunteers, often unpaid, unidentified, and unacknowledged, but they are very integral to the scientific research, and this is one of the most important duty of their professional responsibility and career. So when you are invited to review an article, what is expected of you that you have to set the standards of the field of that study. Then you have to judge fairly and objectively the quality and significance of that research study. Then you have to support and encourage the publication of high quality work. We use this term feedback, but the most, I would say you should use the term feed forward, because this should be constructive, just to aid on to the authors or to researcher, so they can improve their work and their medical writing and everything. And if there are any flaws in the work, you have to challenge and identify those flaws in that research work or article or manuscript. So the first question you should ask yourself, are you the one? Are you the expert enough to do that? So this is very important. So think again, if you are able to do that, accept. Otherwise you can decline. So one of the important, these are some ethical issue which you have to will be coming across when you are asked for the review. First is the conflict of interest, bias, privacy or confidentiality, quality and efficiency, and then raising some concern about the authors or editors if there are any misconducts you suspect.
जिया बेकरार है छाई बहार है आजा मोरे बाल माँ तेरा इंतजार है जिया बेकरार है छाई बहार है आजा मोरे बाल माँ तेरा इंतजार है सूरज देखे चंदा देखे सब देखे हम तरसे हो सब देखे हम तरसे
This is a beautiful song. I think आप लोग इसको पूरा सुनना चाहेंगे, पूरा सुनना चाहते हैं ना? But this is unfortunate. I heard this song, आजा मोरे बालमा तेरा इंतजार है. This was response from one of my medical colleagues who was actually he was sent an article to review by one of the editor of the journal. And because he knew the author and he disliked him, he had some professional jealousy with him. And the editor who sent the article to this reviewer, he also had he didn't he knew about all these vendetta, but he intentionally sent it to this to such reviewer that he will be probably rejecting this article. So this happens in our daily life. So this is actually what we call conflict of interest. So something which can influence the objectivity of the reviewer. There are peer review objectives, and then there are personal objectives or interests. So if they are not balanced, if you prefer personal interest over the assigned job or task which you have been asked for, this is conflict of. If you suspect anything like that, you should disclose it. And I mean, usually you have, this is mandatory to disclose all such conflict of interest at the start of your so when you are asked for review. Say if you know the authors, they are friend to you, they are relative to you, they are your professional colleagues which you don't like, their institution, they Dr. Saab mentioned about the institution. So if you know their institution, sometime there may be I mean professional jealousy between the institution also. And sometime I mean, if some of the researcher may have worked with you previously on different projects, so they are already known to you in a way. So these are conflict of interest. You have to be very careful and very vigilant about them. So if there anything which you suspect that this will I mean influence your objectivity to execute review process, then you should disclose it at some time. Initially you may accept the article for review because you may not be knowing the author, but when you have read the article, sometime you may come to know that the conclusion which the study is giving ultimately is against one of your well-known public stance regarding that topic. Say if there is an procedure or technique for surgery which you educate publicly everywhere, and you are strong educator for that, and in this article the conclusion is totally against that. So even at this time, when you came to know that now this is something which is in conflict of interest, you can decline, or you can discuss it with the editor and inform him about what's actually is. So this is very important. Then bias, when you receive invitation to review, again, it may be, as Dr. Taiba discussed, about different models, single blind, double blind. And if you think that there may be some bias from yourself towards the authors, his race, his gender, his institutional affiliations, or even nationality. So think again, and at the same time you can decide if you would like to carry on or proceed with review or decline. Then confidentiality, because this is the article or the manuscript, as you mentioned, editor should only pass on the relevant information to the reviewers. This also depends on the model which is used for the review, but avoid passing on identifying information to the reviewers, especially in the blind models. So review document is confidential. You have to keep it locked, everything like that. And even avoid it sharing with other colleagues verbally, like you are sitting with your colleague and then you tell them that you have received an article of Mr. and so, and you are going to review it. Again, this is against the ethics, and you should, because this is just for you and you have to keep it confidential. Sometimes some of the senior colleagues, because they are very busy, they are having less time, so they will ask one of their colleagues, one of their junior colleagues, to review that for it. Again, you have to inform the editors about that, and the editor may send it. You can recommend their names for as reviewers to the editors. They can send it directly or give you permission to send that document to one of your colleagues. But if you are doing it just on your own without telling the editors, this is against ethics. Sometime you may need to comment, as Dr. Saab mentioned, which may be blunt or something, maybe a little bit what you were referring about. So sometime you can just directly discuss them or share them with the editor. You don't have to write in your comment form. You can just write to the editor about those points which you would like to. So again, quality and efficiency. Time is important. Again, time is for everyone, especially for in our profession. Time is money. So time frame, you will get articles with the time frame to be reviewed within 24 hours, 3 days, 1 week, 2 weeks. And if you can do it in that specific time, then accept. If you are busy, if you cannot do it, better to tell them at once so that they can ask some other reviewers. And this is very important that the scientific work should come out at proper time. If it is being delayed from just because of that you are not having time, so this is against ethics. So you have to inform or declare a decline to the editors. Again, quality reviews, because this is constructive and positive thing. So you have to keep yourself updated about that topic. Sometime if you are say you are vitretina man and you have received an article regarding vitretina study, then if you have not read that article, you can update yourself and then review, because this is one of the important job which you are one of your important service to the scientific community. So if you just start rejecting and declining articles, probably keeping all these points in your mind, then there will be no one to review articles actually. So this is very important. So your comments should be detailed enough, they should be constructive, and they should be supported by the evidence. Dr. Shahid mentioned about an article in one of his comments. So this is important. And then if there are any concerns about the authors or editors, say like if you are identified that this article is having a lot of plagiarism, if you know that the data is fabricated, if you have some suspicions about the authorships or the authors who are there, so you have to intimate and discuss these issues with the editors. You don't have to write directly to the author. So you can just write to the editor. And if you suspect editor's involvement, like Aja More Balma wale kisse mein editor bhi involved tha, so then you have to find, say, publication ethics committee may be there. There may be research integrity contact which may be there on website of these journals. So then you have to look for that and find that and then report accordingly. Thank you very much. Review process is it needs its integrity and transparency, and reviewer has to ensure that. At the end, I would like all of you to Khyber Icon in Peshawar, which is going to be held from 10th to 12th February 2023. This is another, upcoming mega event of Ophthalmological Society of Pakistan. So please be there. Thank you very much. So if there are any queries, please feel. Conflict से, as Dr. Saab mentioned, sometime they may editors की गलती से आपके पास कोई आर्टिकल आ जाएगा, उसके साथ इंस्टीट्यूट का नाम लिखा हो, ठीक है, लिखा होगा किंग एडवर्ड में। अगर मैं कहता हूँ नहीं किंग एडवर्ड के छोड़ो, हर वक्त इनके आर्टिकल आते रहते, तो ये कन्फ्लिक्ट ऑफ इंटरेस्ट है जो आपको आइडेंटिफाई करना होगा। अगर डबल ब्लाइंड में जैसे मैंने कहा कि कोई आर्टिकल है और उसमें आप पहले से आपने काफी रिसर्च किया हुआ है और आपका एक वेल नोन स्टांस है और सबको पता है कि डॉक्टर सनाउल्लाह ये टेक्निक यूज करते हैं, इसी को एडुकेट करते हैं, और उसमें वो टोटली डिफरेंट रिजल्ट्स आ रहे हैं, कंक्लूजन, तो ये भी कन्फ्लिक्ट ऑफ इंटरेस्ट है। तो इस टाइप की चीजें, या आपको शक हो जाए, ठीक है ना, आपको शक हो जाए कि ये आर्टिकल प्रॉब्ली डॉक्टर साहब ने लिखा होगा और मैं इनको जानता हूं और ये मेरे पहले से लाइकिंग डिसलाइकिंग है, तो अगेन बिकॉज ये शुरू में मैंने जो आपको कोड दिखाया ना, ये आपका अपने अंदर दिल का वो है, कभी कभी आप आंखें बंद करके लिख लेंगे, लेकिन ये आपके अपने दिल का है, आप अपने साथ जितना एथिक्स है यही है, आपको खुद ही डिसाइड करना है। Sorry, Yumna, can you rephrase your question? What is?
I want to ask that sometimes the study setting, the study methodology area section of the article sometimes gives us, you can say, study setting idea that yes, it can be conducted in HMC,
Exactly.
it can be conducted in the other
different area.
different areas. So how the authors should not write that then? What should
No,
they
it's
write
actually no. It's up to you. If you
Right.
feel that you can go objectively, you don't have any bias regarding that, then you can just accept and review. But if you feel, if you are suspicious of yourself, then it's a different story. So you may be wrong. You may be suspecting that this study may be from this institute, but it's not sure.
As you have told that in PJO it is double masked, how the writer will come to know that actually it was double masked or not?
Actually, I don't know that it is double mask. Taiba will clarify. In PGO, it is double mask. So the writer, this is actually on the website. Writer will already know about that. That whatever the review process is there, this is the policy of the journal. Different journal use there. You went through all this presentation that Taiba was telling you about. All have their advantages, credits, and discredits. He has to trust. This is whole story is about the trust. If he's sending the article to you, he's trusting you. You are being entrusted.
Okay. I will comment.
Ji, please. Exactly.
मैं सोचो कि दूसरे इंस्टीट्यूट में आ गया हूँ, मुझे पता था कि मैं जब इस इंस्टीट्यूट, लेकिन उस इंस्टीट्यूट मुझे तो पता नहीं है, डबल ब्लाइंड कर दिया गया, इंस्टीट्यूट का नाम नहीं है, लेकिन मुझे पता है कि मेरे मौजूदगी में वहाँ हो रहा था, तो इट इज अगेन बिकम अ बायस्ड. तो आपको फिर भी पता है तो बी फेयर इनफ के नो दिस स्टडी वाज कंडक्टेड और डन इन फ्रंट ऑफ मी, तो फिर उसको अवॉइड कर सकते हैं. ये जो बात आप कह रहे थे, तो जब आप सबमिट करते हो तब तो आपको लिखना है क्लिनिकल सेटिंग क्या है, लेकिन दिस इज द जर्नल हु विल हाइड दिस. जर्नल विल हाइड दिस सो मेक इट ब्लाइंड. आपको पता नहीं है, लेकिन बीइंग यू राइटर यू नीड टू सबमिट योर सेटिंग whatever the setting of your research is.
Whole story is about the trust and yourself. You decide what is wrong, what is right. Thank you very much.
Peer review is a trusted scientific communication between the reviewer and the journal's editor. Thank you, sir, for touching this important aspect of research ethics. I now invite Dr. Hargun for his talk on academic creditability.
Assalamu alaikum and thank you very much. In continuity of the same story of trustworthiness and this all, I would like to start with this academic credibility. Initially, what we learn, what are the objectives of my presentations are, it's to establish a spirit among the researchers to be valuable and reliable. How the researcher would be valuable, it is. And the other objective of my presentation is to make an author reputable and provide fundamentals of academic credibility. So let's learn what is credibility. It's the power of inspiring belief, basically. Here we set a very specific qualities for being trustworthy and believable. This is the credibility. Now, what is credibility and reliability? Say if a piece of information is reliable, that is also credible. But very carefully listen, the information's credibility does not always guarantee its reliability. So there's a very minor difference between reliability and credibility. Every reliable thing is a credible thing, but not always credible thing would be reliable. So let's learn what are the types of credibility. Behavioral psychologists and other web designers have designed, they are defined 4 types of credibility: presumed, reputable, surface, and earned credibility. Let's learn one by one. Presumed credibility. It's a general assumption we make about a brand, even if we haven't experienced it. For example, brand's reputation. It's like in the SEFA, in the OPD, we are sitting. I mean, a person is sitting with like me, with long beard or सफेद बालों के साथ, और कोई patient उसको देखते ही सोचेगा कि ये बहुत बड़ा डॉक्टर है. This is a presumed type of credibility. They haven't trusted, they haven't noticed me, but this is a presumed type of credibility. This is credibility which they had presumed. This is a presumed credibility. Another is a reputed credibility. This is where our colleagues had convinced or had given some reviews about some journal, some person, some doctor, some even any restaurant. So that restaurant, that person has been from the mouth of trustworthiness or other recommendation. So, जैसे कि किसी एड में हम किसी सेलिब्रिटी को देखते हैं कि ये शैम्पू इस्तेमाल कर लो, ये वो को, this is reputable personality had given the recommendation. So this is a reputable type of credibility. So another one is surface credibility. Surface credibility क्या है कि जब हम देखते हैं कि किसी भी टॉपिक का आर्टिकल का जो लोगो है वो बहुत ज़बरदस्त इंस्पायरिंग, चलो इसको पढ़ते हैं. या हम देखते हैं कि ये जो उन्होंने एक विडिक दी है, अट्रैक्टिव स्टेटमेंट देते हैं, दिन पढ़ना पड़ता है. तो क्रेडिबिलिटी इस तरह से जो ये, दिस इज सरफेस टाइप ऑफ क्रेडिबिलिटी. सरफेस क्रेडिबिलिटी, द फर्स्ट इंप्रेशन, इट्स व्हाट पीपल थिंक आफ्टर एन इनिशियल सिंपल इंस्पेक्शन. जैसे आई कैचिंग लोगो है, अट्रैक्टिव कोई टाइटल दे दिया, टाइटल के बाद हम पढ़ने की तरफ जा रहे हैं, उससे पहले हमें पता नहीं है. तो दिस इज अ सरफेस क्रेडिबिलिटी. एंड बेसिकली द अर्नड क्रेडिबिलिटी इज व्हाट दैट यू अर्न बाय योर पर्सनल रेपो एंड एक्सपीरियंस. दैट इज बाय ईदर अ फैंटास्टिक कस्टमर सर्विस और एक्सेप्शनल प्रोडक्ट एक्सपीरियंस. ये वो क्वालिटी है जो हर ऑथर को, रिसर्चर को इस लेवल में जाना है, by their consistent work and their consistent ability. There are the primary, secondary, and tertiary sources of credibility. Look, we had primary source of credibility would be, say, we had research articles and literary work, spot diaries like these. Look at the others are journals and newspapers. Newspaper इतना ज़्यादा रिलायबल नहीं हो सकता, लेकिन अगर टेक्स्ट बुक की बात की जाए, टेक्स्ट बुक, फैक्ट बुक्स एंड डिक्शनरीज, इवन द इंसाइक्लोपीडियाज, these are repeatedly, last third जो tertiary है, this is the combination of the primary and secondary source of credible things. Factors which define your credibility is qualification, your track record, your skills, your surgical article writing skill, whatever, your knowledge on that topic, your reputation, consistency, and your level of seniority and your personal work. These are the factors which define your credibility. So what is the author's credibility? It basically refers the credentials that shows whether author is reliable or not. It basically, author's credibility basically convince readers about whether the claim of author are plausible and correct. It also helps and support authors' ideas and argument whatever they are depicted in their research thing. So author's credibility matters a lot because it directly impact on the readers and your audience. So reputation and credibility can be achieved by substantial evidence developed either by critical thinking. It is not the civil writing. It is it's a cluster, and after it comes after critical thinking, with solid argument and showing unbiasedness in your research. These all factors will contribute your reputation. How does author can sustain? How does author can sustain their credibility? It's only when working systematically, methodically, quote relevant source from where the knowledge or where the phrases or where the data is being taken, and appropriate citation of those references. Then the author can sustain their credibility. These are the components of the credibility. Let's learn one by one. Become trustworthy. As I earlier say in the debate, earn trust and get trust. Trust account is more and important for a researcher than a bank account. Be an expert of that subject. Develop an ability to analyze the situation and provide several potential or solution to that problem or that matter. Consistency makes a reputation a very high bar. Credibility only achieved when every action is consistent from inside out. Genuine. Okay, sometimes what we do, we have to avoid the approach of fake it till you make it. So create authenticity to cultivate credibility. Be sincere, committed, dedicated, willingness, and straightforwardness. These are the basic requirements for the sincere. Respectful, because we shouldn't respect the people because they are colleague, but they basically think they deserve it. Titles are granted and positions are given, but the respect is that earned by the credibility. Become accountable by your own mistakes. Take steps and once the mistakes are identified, take genuine steps to rectify those errors in your research. Be loyal. Credibility grows with sense of mutual commitment to success. It is all about protecting and serving and to be the best interest of the people around you. So be loyal to your audience, to your people around you. Honesty is the core source of credibility, and people stand tall for the values you believe in. Reader's expectation. What do reader expect from an author? Reader rely on you, count on you, reader trust on you and align with you. So use the reliable source and be the decision maker. Whatever decision you put forward your readers, by your credibility, the reader will follow them and they rely on you. So how to address the reader's expectation? Reader, identify your readers. Choose sources they likely to recognize as respectable and authority. References should be well quoted and should not lack authenticity. Reader's expectation determines the effectiveness of research article and author's repo as well. How to address the expectation? Use the university, जैसे सर ने कहा, it should be updated all the when. I mean, you might be updated with the current technologies and current trends in the medical research. Most reliable information must be used. By that we can address the expectation of the readers. Credibility is a higher bar than success. Reader expect us to have backed up a certain assertion with credible evidences. How do we evaluate credibility? Look, these are the checklist. Check the source is in depth, source is there or not. Who is the audience? Sometimes audience may differ from my research. It could be primary level, could be higher level. So check the audience level. Who is the reader? What is the purpose of the source you are utilizing, and who the author are? By this, we can evaluate the credibility. But when I read any paper, so how do I make sure this is a credible author? So we need to check all these parameters. Is the author is using supporting documents or not, and they have a current knowledge on this topic or not? All these are the determinants. So credibility of research reports, how to determine? Check why the study was undertaken. What is the purpose? Does this study will add some knowledge to the previous existing knowledge on the topic? And check who conducted the study, who funded the study. Sometimes the funded studies can be biased, and most of the time those are. And how the data was collected, whether their source of data collection is credible or not. Is the sample size really address the magnitude of the problem existing in the society? Does the research make us secondary data? use the secondary data, and does the research measure what it claims to measure? यानी वो जो alignment of the object of the research with the conclusion is there or not. So there are certain sources when we can determine the whether the source depicted is a reliable source. Look at this. Sometimes when you see EDU, that these all when we see references, if these kind of denominations come, then use it is these are the reliable. Then use it is these are the reliable sources. Other sources could be other website and domain. Website domain could be different. So these are the reliable domains of and reliable sources for the credible sources. There is a CRAP method for evaluating source of credibility.
Sorry to interrupt you. You have to conclude your talk because next
That's
session
great.
will be started.
That's great. So what is the credible source? It's a peer-reviewed journal. This is the hierarchy of credibility. Under सबसे last जो हम देखते हैं, there over here is the unreviewed, which are not reviewed, which are the blog posts, which are least credible. Editorially reviewed, intermediate level, and peer reviewed are the highly credible sources of research. So the last slide would be credibility takes years to build, but few hours to destroy. And credibility is like virginity. If lost once, never recovered. So thank you being all you credible. Any question? Thank you very much.
Thank you very much, because the next session is going to start within 5 minutes. So I will just request all the audience and the speakers to come forward and have a photograph for this session. Thank you very much.